chitta vritti nirodha. Yoga is the removal of fluctuation of the mind. And it is said by Lord Shiva his own words. अहमे वास्मी गोरक्षो मद्रिपम तन्निबोधतः योग मार्गः प्रचाराय मया रूपमिदं धृतम. मैं ही धरती पर गोरखनाथ के रूप में अवतरित कर रहा हूँ. Now, it's my great honor and pleasure uh, to introduce our session chairperson, Dr. T. Vedna sir, and the co-chairperson, Dr. B.N. Joshi sir. Dr. T. Vedna sir is a consultant Ayurveda physician at Sri Lanka. He has completed his BMS from Institute of Indian Medicine, University of Colombo in 1995, followed by the MD Ayurveda from National Institute of Ayurveda, Jaipur in 2010. Sir has also done postgraduate diploma in Ayurveda hospital management from University of California. Sir has served as the specialist Ayurveda medical officer at Provincial Ayurveda Hospital during 2010 to 2017. Sir has also served as the Deputy Director, Technical Medicine at Ministry of Health, Sri Lanka from 2017 to 2013. Sir has contributed as a co-chair, WHO Working Group of Ayurveda, Panchkarma benchmark, and also contributed to the National COVID-19 Indigenous Medical Guideline. Sir is also coordinator, WHO supported project on quality assurance of Ayurveda surgical care. He was appointed as a member advisory committee on the Wellness Tourism Export Development Board, Sri Lanka. Sir is also appointed as a member board of management, postgraduate Institute of Indigenous Medicine, University of Colombo. Sir is also convener for National Committee for Indigenous Medical Guidelines on COVID-19, Ministry of Health, Sri Lanka. Sir, welcome you. Now I would like to introduce Dr. B.N. Joshi sir, the co-chairperson of our session. Dr. B.N. Joshi sir, sir is a conferred PhD from the Herbal Pharmacology Dravguna upon the infertility on the subject during 1992-1996 from Gujarat Ayurveda University, Jamnagar. Sir is a MD Ayurveda doctor in the Herbal Pharmacology from the above university in 1985 to 88. Sir currently practicing promoting an integrated Indian traditional system of health and wellness Ayurveda in United Kingdom and European countries as a director association Ayurveda Academy. Sir did of senior faculty in the College of Ayurveda, UK. Sir is also worked as a tutor in the Thames Valley University, Ealing Broadway in 2001-2002. Sir also served in Middlesex University at UK. Sir has also simultaneously worked in the teaching profession in Ayurveda school in Croatia. Sir is also teaching faculty in the European Academic of Ayurveda. Sir is also practicing as an Ayurveda consultant. Sir is also involved in the APPJ, All Party Parliament Group, working for Indian Traditional System of Health and Well-being. Sir, objective is to spread Ayurveda knowledge throughout the world in UK and European countries. Sir is also currently working as a teaching Ayurveda for year of PG diploma students at the College of Ayurveda, UK. Thank you, sir, for your precious presence here. So now I would like to invite Dr. B.N. Joshi, sir, to introduce our eminent speaker, Dr. Shekhar Annambotla, sir. एक दो ही लाइन है ना.
जय धन्वंतरे नमः. Shubhodayam. Dr. Shekhar Annambotla, President Association of Ayurvedic Professionals of North America, known as AAPNA, USA, who has an Ayurveda professional and doctor qualified from Bharat in 1988. In fact, Dr. Shekhar Annambotla is known to me As a postgraduate student, I was in Jamnagar and an apex body in Ahmedabad under Gujarat Ayurveda University. He was studying, and later on, we again met in Bidar, N.K. Jabshetty Ayurveda College, where he was also working as a lecturer, and I was also. Fortunately, our conference secretary, sir, Dr. Reddy, sir, was also there working in N.K. Jabshetty Ayurveda Medical College in Bidar, Karnataka, under Rajiv Gandhi University of Health Sciences. So Dr. Shekhar, myself, and Dr. Reddy, sir, three were there together. And later on, and he joined with the Maharshi group and then traveled to Holland. And by that time, the Maharshi Ayurveda was the only group where disseminated Ayurveda into Western world, first ever from Bharat, and later on, subsequently finding opportunities, and he has settled in United States, established uh, big organization, AAPNA, and it is well recognized. He's also teaching in universities in Pennsylvania and different NHS, National Health Services known in United Kingdom, similarly in health sector in United States. And Dr. Shekhar is a registered Ayurveda doctor, registered master Ayurveda specialist, registered yoga teacher, licensed integrative bodywork and massage therapist, and faculty member of various Ayurveda schools throughout USA. He is founding director of non-profit organization AAPNA, Association of Ayurvedic Professionals of North America, and OJAS Ayurveda Wellness Center in Pennsylvania. Director of Global Ayurveda Conferences, Limited Company and Global Ayurveda Academy, and Dosha Botanicals in Pennsylvania. The reasons I am telling here, because once you go into the West and you have to qualify in one or the other subjects into the health sector, and there you will be registered like in United States of America, and he will tell you more about it, how he has got and this kind of registration process and practicing. With this short introduction to our beloved professor, I invite Dr. Shekhar Annambotla to take on the dais podium. Thank you, one and all.
Thank you, sir.
Namaste to all. Can you hear me?
Yes, sir.
So, good morning to everyone, students and faculty and distinguished guests who are conducting this conference, international conference, Ayurveda and yoga and naturopath. So, today I will be talking about briefly about the globalization of Ayurveda and the scope of Ayurveda practice in the United States of America. So, I would like to share some of the screen. Are you able to see the screen? Joshi?
Yes, sir. Yes, sir.
So this is already brief discussion. Discussion has happened. I have different credentials and we are doing the activities like that. So one of the other organizations we set up like that, AICC, IAC, that is called American Ayurvedic Certification and Credentialing Accreditation Council. We have established recently. And these are the activities we have done around the globe. I traveled extensively in European countries and all the parts of the world. And we have done all the therapies these are the various organizations I set up the activities there in the United States of America and abroad. And these are the various associations in the between. Now, question with the scope of Ayurveda practice in the abroad. First of all, we need to look into that preventive care. Ayurveda always looks into the preventive care. Swasthasya swastha rakshanam. That is the main principle of our Ayurveda is just how to make the healthy people healthier and to maintain their health. That is very important. That's the reason a lot of people are looking for that. The whole world is suffering with a lot of people with them, NCD, non-communicable diseases. So this can be controlled by doing incorporating Ayurveda principles very good. So like diabetes and obesity and multiple sclerosis and autoimmune disorders, various diseases are there which can have a very good answer through Ayurvedic principles and Ayurvedic technology, Ayurvedic modalities. So for that, we have given a wonderful way of dealing with the Dinacharya is highly explained in Ayurveda. None of the systems of medicine in the world has not explained about Ayurveda, which is in the Dinacharya called daily routine. Daily routine, which is starts with the Ayurveda principles like that. Brahmi stay, which is we studied in Ayurveda schools. First of all, Brahmi stay. How many schools are starting that way to work on that? Now we are adopting the principles of more and more schools are starting around almost like at 10 o'clock, 9 o'clock like that. So now it is a very important that we have to start the schools earlier to establish these things. That means early hours of the school, Brahmi Murta time, the time to start the schools and establish the educational standards and everything. So at least what we need to do, our students and faculties and Ayurveda practitioners should adopt the principles of waking up early and going to bed early. So natural cleansing and detoxification programs are highly explained in Ayurveda. That is the reason a lot of Western participants are Western abroad people who are interested to more detoxification of the body. That's the thing they are looking for that, which is called in the Ayurvedic technology called Panchakarma therapies. So next, the important thing is that we look at also that the proper food recommendations are very important. These things that we have to have. There are so much of information. The Ahara Vidhi Kalpana, Ahara Vidhi Vishesh Vaidhanvi, like there's so many aspects are there. That is missing part of the world. That's the thing what we needed to do. We need to incorporate the principles of Ayurvedic dietetics. It's the thing Ayurvedic nutrition, Ayurvedic diet are very, very important. And it's clearly mentioned in Ayurveda, the Vilta Ahara, incompatible foods. Those things also has to be highlighted and explained properly. And so that's the thing. A lot of people are diseases. Now in the Western world, the obesity is becoming more and more stronger and everything. More and more cases are coming. Why? The reason is that only three major ingredients are creating the problem. One is sugar. Second, salt. Third, oils. This combined together, oils, sugar, salt combined together, it is caramelizes the situation like that and creating the more toxic amides happen. So that is the reason what we needed to do. We need to remove this toxic ama, which is creating the problem, and that is causing the garavisha, which is we call it the garavisha, is the poisonous like a snake venom, which is there. That is the reason a lot of people are suffering with the autoimmune disorders and metabolic disorders and all the different diseases. So that is the reason also very important that diet is a very important role. Then we look into that yoga and breathing techniques also very, very important. As a registered yoga teacher and I practice yoga myself and also we teach yoga for the Ayurvedic practitioners and Ayurvedic students who are willing to come for the Ayurveda training programs. Then seasonal cleansing program, which is mentioned that that is an according to Rutus and Chikitsa means particularly of opening these things in different seasons, particularly winter season, we do the Panchakarma therapies in summer seasons and as well as spring seasons, particularly we do the 3 times of the seasonal cleansing programs. Meditation is also another important tool which we can offer it, and at the same time, a lot of people may not know about how to cook food and culinary skills. This is the missing part in the world as countries which we can provide this type of things. Almost 80% of the diseases can be cured by adopting these tools and technologies scope of Ayurveda practice. That is the reason we are able to successfully practice these things, which is not thinking about that only medicine is not a thinking like that, drug is not a one thing to thinking about that. We need to think about the preventive aspect has to be taken care. So now question comes to the opportunities and challenges in the practice of Ayurveda in the abroad. As you know that Ayurveda is not a license, it's an independent health profession. What we do, we practice with various modalities like that. What they do, study in a allied health professional training programs, certification programs, and licenses, such as agriculture, naturopathy degrees, and as well as medical degrees, and as well as physical therapies and physiotherapy. And there are so many allied health professionals training programs and licenses are available. With that training programs, which you can incorporate Ayurveda as main portion, 90% you can do the Ayurveda portion, and remaining portions you can do it with allied health professional training programs also you can do it. In addition to that, educating the public is very, very important that you should be a teacher. A Latin word, the doctor means is not a practitioner, which is called the doctor, it means a teacher, teach. So this is the thing. How many Ayurveda doctors are teaching really? So it's not necessary that medical schools and everything, what they are doing, they are prescribing the medications and drugs and intervene to the surgical procedures and everything. As you are an Ayurvedic doctor, an Ayurvedic Vaidya or physician, one should have good teaching skills are very, very important. This is a great opportunity for all students to be actively participate in interactive sessions and teaching skills has to be developed. Offering various integrated health programs in the mainstream medical schools and centers. This is also very important because I personally go there to the University of Pennsylvania Medical Schools where I teach the Ayurveda for women's health, Ayurveda for integrative health, and these are the things we teach in various medical schools. So this is the very important way to integrate the Ayurveda principles in the medical schools and the institutions and integrated health professionals. These are the very important things. And what are the problems, challenges which we are noticing that a lot of people think about it, oh, this is the thing what we can do it. And the whole in America, everything is there, you can freely practice and everything. It's not necessarily, it's not in, because the reason is that it is not an independent licensed profession, not accepted as independent allied practitioners are there. Not sufficient Ayurvedic doctors and practitioners, Vaidyas are not available. The number of practitioners in America, particularly if you look into that, about 600 practitioners are there, 600 Ayurvedic doctors are there. And that is not sufficient number. We need to have 600,000. That means almost 6 lakhs people of Ayurveda practitioners are required to practice Ayurveda in more bigger numbers. No standard uniform training is also there. There are schools are offering various Ayurveda programs. Those programs are not as far with the BAM standard or Ayurveda standard programs. So that means we need to bring these standards and more education programs there. There are problems are there when we are teaching these programs there. That is the reason what we do. We train them in theory part through the Zoom, webinars and online systems like that. But what we do, we bring them to the collaborate with various institutions and universities like that. That way we can bring the knowledge to them for practical training program there. So that practical training program, are you ready? Are you ready to teach this type of program for the Western aspects, Western students, Western audience, Western Ayurveda doctors? These are the things that are very important. You need to be competent to teach these programs to the Western audience. And there is no standard large-scale research in Ayurveda happening. That is the thing is important. We have some studies are done. For example, small quantities of Gugulu. Gugulu is very good for the Medo, means particularly good for the cholesterol and hypercholesteremia and all the conditions. But the thing is that number of studies are not done. We need to have thousands of cases and it has to be done. The only it will be more validated. And also, as I mentioned to you, it is not covered by the health insurances. When the health insurances are covered, then it's easy to practice more number of practitioners. So there are several organizations. There's non-profit organizations or NGO organizations, non-governmental organizations are there. Several organizations. This is the list of the organizations. I don't want to go for the one by one list of the organizations. There's almost about 15 to 20 organizations are there promoting Ayurveda in the United States and other parts of the world also. So recent developments in the field of Ayurveda research, there is a systemic research, there is no research, systemic research was done. NIH, National Institute of Health, a breast cancer survivors found positive effect of the integrative Ayurvedic medicine include the diet, lifestyle, yoga, pressure points, particularly Marma therapy done and that has promising results are there. I should work with the Ministry of External Affairs. It's called MIA. We can organize the preventive care research. This is the thing strongly we recommend the organizations to start this type of research work has been done. Experience as an Ayurvedic ambassador. So this is my experience of 35 years. I'm teaching and educating the people worldwide, and this is my background. So what we strongly recommend, the Ayush chairs should be established. Of course, Ayush has done a wonderful job of establishing various chairs in the various countries and deputing the Ayurveda chairpersons from India, from the various institutions around the globe. That means all the Ministry of External Affairs, where the IFS, Indian Foreign Service Consulate Generals are there, where we can incorporate more professors. Particularly, we are highly recommending that the university professors who are willing to work for abroad and go there and establish the Ayush chairs and connect with the local governments and activate these things. This is very, very important. This is coming along. Coming along, it takes a long way to go. First of all, in India, they are establishing more and more schools and education standards and the national levels of standards of education and everything they are bringing. And now it's the globalization of Ayurveda. Time is coming. Now it is a time to bring the Ayurveda to the abroad. That's the thing is important. Then it's also general local organizations or the things like that, like regular meetings with the Ayurvedic organizations and everything is important. And meeting with the local renowned Ayurvedic practitioners who are practicing more than 35, 40 years ago, practicing there. Those who are meeting, regular meetings are important, and organizing various international conferences in the abroad. Also, that is also important to activate the Ayush Ministry. This is the suggestions for the Ayush Ministry we are doing by this. So, legal strategies and norms in the concerns of the preventive practice of the Ayurveda. So, always we look at the legal aspects and whether we are allowed to practice this. So, what we do, we try to do a standards for Ayurveda education in the various in parts of things. We cannot bring the BAMS course 4.5 years to 5 years of training program in abroad, particularly because the lengthy process and everything, and language is also difficult for them. Because Sanskrit is the majority people are not able to understand it. That's the reason what we needed to do. We need to have a comprehensive program, very practical program. We have to provide it like that. What we are trying to do, this is the thing what we came up with these things. So we have come up with the Ayurvedic lifestyle consultant, Ayurvedic health counselor, Ayurvedic practitioner, advanced Ayurvedic practitioner, which is almost like a BAMS training program of 4,000 hours of training program is there. Then we have a master Ayurvedic specialist is there, and that is the thing is also integrated Ayurvedic practitioners, integrated Ayurvedic researchers are there. Those who have completed PhD program, those things they can be doing research work there. And these are the various standards of the training program like that. Ayurvedic and nutrition specializations like that, Panchakarma technician, Dhamma therapist, and we are teaching these are the various courses for people like that, which is equally about 500 hours of Ayurvedic lifestyle consultant program, and as well as the specialized program, 500 hours of extra training from Ayurvedic yoga therapist, Ayurvedic doula therapist, and Ayurvedic polarity therapist, and herbalist, Ayurvedic pharmacist, Ayurvedic psychology consultant, Manashastra, and spa and beauty therapist, and also Vastu consultant. Vastu Shastra is very important also here. And Feng Shui is called similar like Feng Shui. And at the same time, Vedic astrology, Jyotisha is also consultation, and meditation, spirituality instructors, various levels of training programs we can offer. And public awareness is very, very important. Educating public demand is very important. When the public demand is there, so that is the thing. Our Prime Minister Modi ji saying that Ghar Ghar Ayurveda. That means every house has to household name of Ayurveda should come. That is the thing. The same thing in the United States of America. We are bringing the Ayurveda in the Ghar Ghar Ayurveda in America. That is the thing. Our goal is to bring the Ayurveda for every house. Next, this is the thing. American College of Ayurveda we are establishing, and we are training the students and the integrated professionals and everything. These are the levels of training programs. What we are offering the various training programs in there. Ayurveda degree programs. So what we are trying to do, 4-year degree program, which is there. First year, Ayurveda lifestyle consultant. Second year program, Ayurveda consultant program, counselor, and Ayurvedic practitioner. And fourth year, advanced Ayurvedic practitioner, like that 4-year program. Do it like that. similar programs like that, similar way. So these are the syllabus is also structured like that according to Ayurvedic lifestyle consultant program, health counselor program, Ayurvedic practitioner, advanced Ayurvedic practitioners, and we have also created an AACC, that means American Ayurvedic Certification and Credentialing Accreditation Council we have created, and this is the thing we established like that, and this is the thing: education, standards, safety, quality, recognition, regulation, and licensing. These are the things are our goal is to motivate the public and bring the awareness to the Ayurveda forefront to the integrated healthcare. So this is the organization setups and everything. We have councils are there. We have created the workshops and everything. We have done a lot of work there here and activities there. So many activities are going on there. And we are also recognizing the world top Ayurveda doctors, also recognizing them, the senior most Ayurveda doctors who are recognized and established their practices and working successfully, not only clinical way, clinical research and the educational way, they are doing like that. This is the thing we are doing. And we have a board of directors and advisory board, and directors are there, and fellowship also. We created a fellow of Association of Ayurveda Professionals in North America, USA. We have created all the information there on the website. So we are also recently we have developed a program called postgraduate diploma in Ayurveda for exclusively for the licensed health professionals. That means those who are medical doctors and acupuncturists, naturopathic doctors who are licensed in the profession, and those people can take this postgraduate diploma in Ayurveda based on the World Health Organization and the Ayush Ministry and benchmark training program in Ayurveda. According to that, we have standard things. For that, Global Ayurveda Academy, to this, we have established various training programs this way. And this program is based on these things. This is the 2,000 hours of training program, which is provided there, and diploma is given to them. And prerequisite, there must be licensed health professional. They should have the graduation, the licensed health professional. Very, very important. And then we have given the specimen of the program, which is the modules 1, module 2, module 3, like that. See the thing, module 1, that module 1 components are the fundamental principles of Ayurveda, and then para and preclinical components are there, and then clinical components are there in the Ayurveda program. And then at the same time, finally, supervised clinical training program, which we are doing 500 hours of training program, which they can come to India or Sri Lanka or Nepal, where the countries where the Ayurveda is fully licensed, like that, where they can go. This is the modules we are going to put them there. These are the supporting organizations, where the supporting organizations are there. We work on that. And also these institutions, various institutions, we are collaborating, and MOUs we are creating with Parul University and BMK Ayurveda Mahavidyalaya, Belgaum, and SDM Ayurvedic College, Hassan, and at the same time the Manasarovar Global University, and at the same time Dattamega Institute of Institute Vardham, Maharashtra, and along with that Aradhana Ayurveda Wellness Centers, NGO organization in Hyderabad, and at the same time Sridhariyam Institute, Kerala, and we have an Atreya Ayurveda Institute in Bangalore, and Rajasthan Ayurveda University in Jodhpur, and Bliss Ayurveda Institute, private organization, we did it, and Jiva Institute of Ayurveda, and as the Greens Ayurveda Center in Kerala, and as the All India Institute of Ayurveda, New Delhi, and various institutions are there. We have membership organizations also there. Then we have established 22 years. This organization established world's largest number of people who are participating in this organization. Now, if we look into that, this is the thing. This we are doing. Next, we have done various conferences next month. Actually, this next week I am coming to India. I'm coming to India and spending time in India, and then we are conducting this conference in Bangkok, in Thailand, where we are doing collaborating with the Kayamana Institute, the Yoga and Ayurveda Institute, where we are doing this conference. These are the various experts who are Master Kamal, who is a Guinness Book World Record, and the Master Delpe, who is a spiritual leader in the Philippines, and myself. We are organizing this conference, the 65th International Conference in February, and you are all most welcome to come and participate as the speakers. And the good news is that you don't need to have a visa for coming to Bangkok. Thailand, you don't need a visa. You can walk. You can immigration can be done clearly for you. If you have a passport is there, it's easy for you to come and participate in these things. That way, interact with these various countries, how the Ayurveda globalization can take place. That's the thing is very, very important. And this, these are the various activities we are doing to that. And we are also doing in a sixth international conference. We do regularly. A lot of people may know, faculties and postgraduate students, and everybody knows about that. We do the various conferences on various topics are there. Ayurveda and endometriosis. This thing March 15th and 16th online Zoom, through the Zoom we are doing these conferences through the global Ayurveda conferences.com. And this is the 67th conference. Physically, we are doing conference Ayurveda and the Mind in Pennsylvania, where we are doing this conference May 1st to 4th. And we have already 24 speakers are speaking on this conference. And it is an excellent way of connecting with people. And basically, mind is very important. Psychology is very important in Ayurveda, and which is very crucial in the Western countries, like that. People who are psychologically disturbance is there, and family disharmonies and financial disharmony. And we think about that abroad is very healthy people, all are healthy and they are looking good and everything. It's not necessary. We see a lot of people having emotional issues, stress management issues are there. That is the thing what we do. We manage the stress by proper educating. Ayurveda is having a wonderful abundance. Knowledge is there. Abundant tools are there which we can incorporate. We can connect with them, and we can do soul to soul, heart to heart connection is there. That is, I think, is very, very important. That connecting to their physiology is very, very important. Their connectivity with their heart is very important. And these are the various conferences we conducted since so many years. These are the list of the conferences we posted on the website. There are the things on the board certifications also. We have created various board certification examinations like that, conducting like that. And there's the registration for the PAMS people and everything, free registration for Ayurveda pharmacists who are completed the pharmacy programs. We have registration link is there. And World Ayurveda Specialist called class, which is called, and we have a MD Ayurveda, MS Ayurveda people, postgraduate people who can register as a World Ayurveda Specialist. Then we have a Global Ayurveda Doctors Day. This is the only one organization we have established such a way that October 3rd is a day we do this every year. We do this and annually. Global Ayurveda Doctors Day. This is the thing we are conducting like that. Activities are happening there and posted on this. This is the third, next October 3rd. That is the third Global Ayurveda meeting is happening. People can participate, all the faculties and teachers and postgraduate students, everybody, Ayurveda doctors, BAMS doctors, everybody can join in this meeting free of cost. Then we have a 10th World Ayurveda Day, National Ayurveda Day we are celebrating, where we are doing worldwide. And then we have an October 18th, 2025, we are doing an online virtual Zoom meeting. AAPNA organizing 10th World Ayurveda Day. And these are the list of the organizations, things like that. Until 2047, we have declared about 32 various Ayurveda Day, World Ayurveda Days are explained like that in the website posted there. And these are the members around the globe. We have in various countries, 134 countries. We have members are there. This is the largest network of organization and connecting professionals and everything. And various countries, not only one country is that here, and Denmark, and Dominica, and Egypt, and El Salvador, Estonia, Fiji Islands, Finland, all the various countries we have members are there, and global supporting members and various things are there. You can see all the countries, Norway, Oman, Pakistan also, we have members from Pakistan also. And these are the Zimbabwe countries. This is my clinical setup, my practice here. This is my practice clinical location where the Ayurveda Wellness Center is there. And the patients can stay here and receive the Panchakarma therapies. We do Panchakarma therapies, even 21 days Panchakarma therapies, 58 days Panchakarma therapies. There's a sequentially there on our website called ojas.us. Go to the website ojas.us. Website gives all the information about that, how we are successfully practicing Ayurveda very successfully. You need to have passion for doing this practice. Ayurveda dedication is important, and then only you will be successful. Passion, persistence is very, very important. Then you will be successful in practice. And this is the various outline of the since 1988 to 2024. These are the 3,581 Panchakarma therapies I have conducted. So there are so many days, 1 day, 1 day program, 3 day program, 5 days program, 7 days program, 10 days program, 15 days program, 21 days program, 58 days programs also conducted. And these are the list of the things, various things where we did it each year, how the database we created like that. That's the thing we established like that. And where we are doing various therapies also we are doing, not only consultation. I have done myself 31,000 consultation, Ayurveda consultation in the United States of America, and Panchakarma therapies. We do all the Abhyangas, Svedana therapy, Marma therapy, and hand and foot massages, and back and shoulder neck massages, Fiji, the Kerala therapies, particularly Virechana therapy, Udvartana therapy, and Dhumapana therapy also we have performed like that. Pinda Sveda, Grivavasti, and prenatal massages also we have done. Pregnancy people who are pregnant women can receive the relaxation therapies, the prenatal care, and also we have done massages like that. Ayurvedic facial therapies, aroma therapies, and Karnapurana, Shirodhara, and Shiropichu, and Darshana therapies, and 1 day wonders, Kati Basti, Jan Basti, whatnot. We can do even the cooking classes. We have conducted cooking classes, 784 cooking classes. That way, we are able to educate the people. Then they are connecting to this. There's also in the trigger point massage therapy, and prana healing energy therapies, head massages, and reflexology, and pranic healing, and meditation classes, whatnot. We can teach Ayurvedic practitioners can be do lot of wonders. Like they're not necessary that we have to practice allopathy medicine. Allopathy, if you needed to have allopathy, you need to recommend to the allopathy doctor to recommend to take care of that. Same way, allopathic doctors need to not necessarily to study more in Ayurveda, they need to educate themselves where they have sent our practitioners, patients to us. That is the thing, that is our domain. That is our domain is that we practice Ayurveda full form and with all the modalities with various herbs, various the Adravya Bhuta Chikitsa is there clearly with the Chikitsa is clearly we learned that the three types of Chikitsa, Daiva Vyapasaya Chikitsa, Yukti Vyapasaya Chikitsa, Sattvavajaya Chikitsa. So what we are studying three things. Sattvavajaya Chikitsa means where psychotherapy, psychology is very, very important. Manashastra is very important. At the same time, whatever we are doing, all the colleges and hospitals, Travyaguna and all the herbs we are giving, and combination of herbs and things like that, oils, preparations, and everything we are doing, whatever things we are doing, that is all Yukti Vyapasaya. And Daiva Vyapasaya with the Madimangala, Bayivahara, Homani, Price, Upavasa, all the different things which we can incorporate. We have to incorporate gem therapies and all the varieties of therapies. That will be a wonderful way of groups. There is a lot of knowledge is going to be lost. We are not able to use them properly. And mantra chikitsa is very powerful. And in the ancient textbooks, Siddha Vaidyastu Mantrika. Siddha Vaidyastu Mantrika. The person who is a Siddha is expert in the field of Ayurveda and Ayurvedic knowledge. Then he will be a mantrika, he is a magician. So you need to be a magician to practice Ayurveda and at the same time to teach the Ayurveda for the people and help the people in such a way that you will be a successful practitioners like us. So these are the various ways of years to do all the activities. We did it since 1988. My practice started in 31,000 Ayurvedic massages we have done, Ayurvedic therapies and done. This is the clinical study I done, and so these are the various 1400 Panchakarma subjects we have done research work on these things. I wanted to go very fast and everything, finish it up this limited time that we have. And these are number of patients who are received number of subjects and everything. And then we went to the next level is the Panchakarma therapies, male and female. More female therapies, 70% females are inclined to go with the Panchakarma therapies than compared to the men. Men only 20% of the people are, 30% of the people who are getting, and whereas 70% is gender variations, and more Pitta and Vata dominant people are more than compared to the other fields like that. Maybe Vata Kapha are there, but more Pitta Vata are noticed. Then Prakriti assessment we did it, and Sattva Rajas Tamo Gunas, and according to that Rajasic people are more and getting Panchakarma therapies and everything. And at the same time, we have seen the Apana Vata imbalance is there, Sadhaka Pitta imbalance is there. We need to know about these doshas and everything. We need to understand the principles and everything, how the which dosha is involved, like the subdosha is involved, dhatu involved, which sloka is involved. And this is exactly what we do practice in Ayurveda. That is our lingo, that is our language, what we talk about. It is hypothyroidism, thyroidism, diabetes, these are all cancer, these are all not our language. This is our language. Our language we have to speak. Then only legally you will not be getting problems. If you talk in a such a way that the more modern technology, modern knowledge you are using, and you will be susceptible to get the legal lawsuits. That's the thing you have to be very careful when you are practicing abroad. All the legal aspects you have to take into consideration. It's very important how you practice Ayurveda in this country. So next involvement of the dhatus, various dhatus are the rasadhatu involvement in the more patients, and we have done also Vishama, irregular the digestive system, Agni levels also we have studied like that, and in patients, and Costa, and Costa also, poor Costa and rigid patients also there. We have noticed that, and vegetarians and non-vegetarian diet is also taken into consideration like that, and at the same time, and they have also varieties of treatments, various therapies. We have gone through the process like that. We done that way, and then how the individual people who are responsible, like the Panchakarma therapies and everything, digestion has improved a lot, and sleep patterns, constipation, clearance of the sinuses, flexibility of joint, physical energy, lightness in the body, discomfort and pain, dryness of the skin, fatigue and circulation, and vision issues and everything, breathing pattern, cardiovascular endurance and gas influence, flatulence and complexion, allergies and immune system, physical therapies and everything, migraine, menstrual conditions, backache and overall health care. Physical wellness also we have performed. All the studies are done, complete, marked and moderate and mild and no improvement. All the different levels of standards we have created like that. And we worked on that and see the duration of Panchakarma, which I have done, various people like that, how the things are there. And this is the Veda Pulse technology we have used before and after treatment, how the Panchakarma is before treatment by Pitta is high, and then when it came down to the normalcy after doing a Virechana therapy and Panchakarma therapy. Then we have seen the subdoshas, how the doshas of the Sadhaka Pitta is high, and here you can see the Pitta, Sadhaka Pitta came down. So this is the thing before and after treatment, and here you can see the Avalamba kapha is stronger, and then it came down to the normalcy. And then you can see the subdoshas of excessive Sadhaka Pitta and Tarpa kapha involvement. Then in the dhatu level, how the vitiation is happening. Rakta dhatu is involved here, more Rakta dhatu is there. Then in this patient, more tension, the rasadhatu depletion is happening, at the same time Rakta dhatu vitiation is happening, and Mamsadhatu vitiation is happening. You can see the vitiations are there, and at the same time, you can see the rasadhatu vitiation is there in this patient. And Mamsadhatu, Mamsa is what is involved there also, everything. How the depletion of Mamsadhatu and the various dhatu levels also we have to understand these things, the concept is there, and the Agni, depletion, Prithvi, and elements also, how the Panchamahabhutas, how they impact on the systems and everything. We have done that. And the bioenergetic level, chakra energy also, we have looked into that. Here, this person having Sahasrara chakra and Ajna chakra and Manipur chakras are strong. And when it comes to the after treatment and everything is normalized, and everything, green signal it shows that a normalization of things. Then before and after treatments also we have done some changes, and aura, complete aura, body aura, you have looked into that, various levels of changes have seen that in this capture. So even the spinal levels also, people who are having spinal problems are there, the inflammation, this is called not deformities, which we don't call it deformities. This is inflammation, the C1 level and the C3 level and C4 levels, and the thoracic levels and everything, and depletion of energy in thoracic too, and there's a lack of energy in this area, and we have seen this, and improvements levels also we have seen very systematically, and worked on these things and how the improvement taking place and everything has shown very successfully and very improved way like that. So that's the reason we say that this is the thing. Thank you one and all for giving us such a wonderful opportunity for me to speak in this audience and participants like that. I really appreciate all of you. Passion is there. You have to dedicate your time. It is a long journey. Ayurveda is not a shortcut journey. Ayurveda is a study of 9 years of medical school. Like a medical doctors, how they go through the process. We also go through the process of 9 years of medical school. We are more superior than the things that we have to study Sanskrit. We have to language, foreign language. The Sanskrit we have to study. At the same time, we have to study also about anatomy, physiology, pathology, and everything. In addition to that, all the Dravya Guna, Rishi Shastra, and various things we have to study. Then only we can be a successful practitioners, and we have to go through the process of studying and various aspects and everything we have to do that. So that's the reason I request you to hardly work hard, and you will study very well, and you will be thankful to all of them, particularly we other institutions where you are studying, universities and colleges, and particularly professors who are teaching you. And Guru Deva Bhava means Guru means teacher is the Deva. It's you are treating them as the Deva. Then you will be very well nurtured and successful. And I am always thankful to all my students. And at the same time, I am a student. I always tell my students that I am a student of Ayurveda. It's a lifetime study of Ayurveda. Thank you very much. One and all. Namaste to all. Namaste. I'm happy to take any questions you have. I'll be happy to answer these questions. This is the globalization of Ayurveda, scope of Ayurveda. There's a lot of scope is there. Still, we need to do. This 30 years I'm working in the United States of America. Still a long way to go. Thank you. Questions? Yoshi, any questions?
The non-communicable diseases and other communicable diseases also spread day by day worldwide. Therefore, there is huge demand for the alternative system of medicine. In that way, it is very important to polish in and that update in our clinical experience, and we have to bring this system to the standard level. In that way, conducting this type of international conferences, it is very, very important. And by that way, most of the students willing to join this stream, they will be able to enhance their clinical skills and everything by sharing knowledge. In that way, I would like to thanks Dr. Shekhar, President AAPNA Ayurveda USA, share even online. He has given informative lecture for this audience. Thank you very much, Dr. Shekhar.
Thank you, sir.